In Good Shape, your weekly dose of health information on DWTV. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition and beauty. Medical professionals, therapists, and counselors are in our studio every week to offer their expert advice on In Good Shape.
Taking good care of the neck, the spine and all related pains and injuries is day-to-day business in Berlin's renowned Charité hospital. And that's where my guest in the studio works, Dr. Alexander.disch. Thank you very much for joining us today.
Thank you for your invitation.
Dr. Disch, why is it, from your experience in the clinic, that so many young people suffer from neck pain?
If we talk about neck pain, it's most of the time it's muscular hardening, and this muscular hardening is based on bad posture in most of the cases. Only in a small amount of cases it's degenerative disease or even trauma or something like that. It's often bad posture in the everyday life of the patients.
So meaning the way we sit, the way we walk or stand, it affects the neck, right?
Yeah, the way we have to work every day or have our everyday life, sit in the same position for the day or work in the same position, even working hard, makes a muscular spasm or a muscular strain, and this causes neck pain.
Mm-hmm. Well, what forms of therapy would you say, from your experience, are most effective when it comes to neck pain?
We divide in two phases or two grades. In the first phase, I think we should try to relieve pain, and we achieve that. We do massages with the patients. We give them muscle relaxants or even painkillers, and do that for an amount of 7 to 14 days. And then we start exercising with the patients to stabilize the cervical spine, and the neck pain will disappear.
Mm-hmm. When it comes to therapy with neck pain, chiropractors often offer to do a manipulation where they crack your spine in some way. Is that advisable? Is that dangerous?
Some kinds of neck pain, they are caused by hypermobilities of the cervical spine, and then this is really helpful. Most of the patients know that. But you should go to, I think, a medical doctor or someone who has a medical background to do that, because it can be dangerous.
So someone who's qualified to
Yes.
crack your spine. Mm-hmm. Well, we've had lots of viewers' questions about this topic, and there was one question that many people ask. For example, Bashar Mahmoud from Syria, he wants to know if cracking your neck when you move your head like this, for example, is that dangerous, is that harmful?
In most of the cases it's not, because many people have that problem, or they know that it brings a pain relief. It's just wrongly sticking together the parts of the cervical spine, and then it's suddenly released and you hear that cracking then. So in most of the cases it's not dangerous. It can be problematic if you have a higher degree of degenerative disease or something else, but this is only a small amount of patients that have that problem.
So that helps with pain. You were mentioning painkillers before when you have severe acute neck pain. For how long is it okay to take painkillers with neck pain, and when should you go and see a doctor about your problems?
I think for 7 to 10 days it's okay to treat yourself, and then if it will not disappear or the pain will stay, you have to go to the doctor and see a doctor and do more diagnostics.
Mm-hmm. When can neck pain be a symptom for more serious underlying problems?
If this neck pain is combined to other symptoms like irradiating pain to your arms, if you have numbness in your fingers, or you have a loss of function, if you're not able to put a cup of tea in your hand or to drink a glass of water or something like that, or lift your arm, then you should immediately go to your doctor.
If you're in acute neck pain, should you be keeping moving, or should you try to avoid exercise?
You should keep on moving, but you should avoid special exercises, especially with weights, because in the first phase you should relieve your pain, get the pain down, and then you can start with special exercises.
Mm-hmm. So special exercises, you say, do we need special exercises, or is just any exercise like swimming or going for a run good enough?
And there are some studies, they compared general activity to special exercise, and how they influence the outcome on neck pain. And they really showed that special exercises are really more helpful to relieve neck pain in a short time period.
All right, so special exercises to strengthen your neck. Can you show us one or two?
Yeah, there's, for example, you should carry a little weight, so like a bottle of water or something like that, and then you can put your shoulders up or shrug. You lift your shoulders.
And you have the weight in your hand.
And the weight in your hands, just to strengthen the muscles in the neck. Or the other one is just to go on like this, rowing on the one side.
With the bottle or the weight in your hand,
the weight
right?
in your hand. The other one is lift that weight up in front of you to your face and put it down. Do this 12 repeatings and do this 3 to 5 times a week.
And so no more neck pain?
Maybe no more neck pain if there's not something more serious.
Well, that sounds good. There is lots of aids and gadgets out there that are supposedly helping you with your neck pain, like pillows that make you sit upright or a sitting ball, for example. How good are these from your experience?
Sitting is really a difficult problem because all these gadgets like balls showed that they are not really as helpful as a good chair. So maybe it's better to get a good chair. From my point of view, what is really helpful are anatomically shaped mattresses or pillows, because 1/3 of the day we sleep, and that's what maybe brings more muscle relaxation than a ball in front of your desk.
So anatomically shaped, meaning you have to really go to a specialist when you buy it to make sure it's not too hard, not too soft.
Yes.
All right, so now give us your top 3 tips to avoid neck pain in the first place.
Avoid bad posture. Try to change your posture as much as you can. Do special exercises and do it regularly.
Do you do it?
No.
Well, now you have to start. You're on television with that. Thank you very much for joining us today. Thanks.